During this pandemic, people still need access to their prescriptions and medicines to treat illness. I'm joined now by Joseph Faulhaber. He is a doctor of pharmacology at St. Vincent's Medical Center in Bridgeport. Thank you so much for being with us.
Happy to be here.
How has your role changed since COVID-19?
So, I think a lot of healthcare providers, the roles have changed significantly. We have stepped up to the plate and we give it 110% every day when we come to treat our patients. And I'm honored to work with everyone that has been doing so. And, my role as emergency medicine pharmacist, I'm there in the ED taking care of, helping the physicians and nurses take care of these patients. But I'm also working with the ICU, helping them do the same thing. As pharmacists, we are the medication experts, and we're there helping the physicians with any recommendations they need and making sure the patients are on appropriate therapy. We look at their labs, making sure that the drug is okay and safe for them to be using. We'll reach out to them if we have any changes we think we need to be made. And then the physicians and providers have been very appreciative of our work for them.
We hear so much in the news about experimental treatments with this virus. What kind of meds are being used?
So we have been sticking with the recommendations from the CDC and FDA. What they've been recommending, we've been using. They constantly come out with new recommendations on how to help treat some of these patients. And we've been following that with every time they come out with the new recommendations. We also use supportive care medication. So if a patient comes in and they have a hard time breathing, we'll give them a nebulizer. If a patient needed to be intubated and on a ventilator, we'll give them a sedative med. And if a patient has high blood pressure, we'll give them a medication to lower it. These are just some of the supportive care meds that we use, but we're tailoring everything to the patient because this isn't a one-size treatment option that fits everyone. So we're going through our patients, making sure they're treated appropriately.
Do you have enough supply of the drugs, or is it hard to get some of them?
No, so our supply is very good. We learned from Italy that, they had a lot of patients that needed to be on ventilators. And when you're on a vent, you need to be sedated. So we knew as more of the coronavirus cases would start coming to the United States, that a lot of hospitals across the country would be using more of these sedative meds. So we were proactive with meeting with a bunch of, different physicians. The pharmacy team met with the chairs. We sat down and we created the medications on our backup plan to use. And we also made a backup plan to our backup plan. So like a plan C,
right,
in case the wholesalers were not able to supply us or any of the hospitals across the country with certain meds because of the increase in demand for them. Fortunately enough, we had not had to go to these backup plans. These plans are just as efficacious as our plan A, but we were all in alignment with, we needed to go down that route. We were ready for it, and we were prepared to continue to care for our patients.
right.
And like I said, the wholesalers have been doing a good job with providing hospitals with these medications.
Good thing for Connecticut that we are not facing those shortages. Thank you so much for being with us.
My pleasure. Thank you.